Hello, my name is Michael Zeglinski, Senior Vice President of Specialty Pharmacy at OptumRx. Many times we are asked, are there tests, are there biological markers in order to determine what would be the best biologic in order to prescribe for certain patients? We frequently see patients starting on medications and then after a period of time not experiencing the benefit we would like to see, and then they would need to switch to another product. We have essentially a trial and error approach at times to determining what are the best drugs. So the logical thing would be is, can we look at the person's specific biology, essentially do a genetic test or something else in order to determine from the outset which biologic would be best? Unfortunately, at this time, we do not have those tests available, but there are numerous companies working on this, determining which genes specifically are affected by the medications that are available. So we would expect within at least the next 5 to 10 years to start seeing better diagnosis opportunities by having genetic tests or biological markers used to pick the right drug for the patient the first time. When we look at biomarkers and we're determining which treatments to use, many times we also are looking at specific diagnosing tests. And the question comes up, what types of tests should we be using for biomarkers in order to determine what treatment is given? To the extent that they're available right now, they are not utilized as frequently or as regularly as we would like. But again, within the next 5 to 10 years, we expect there to be far more diagnostic tests available to determine during the diagnosis phase what we would use in order to select the appropriate treatment for the patient. When managed care companies are determining to approve therapy for a patient with an autoimmune disease such as psoriasis, psoriatic arthritis, we frequently are wondering, what are they using as their prior auth criteria? Are they using any specific tests, any specific diagnostic markers in order to require that the testing is done and used before the authorization is given to pay for the medication? At this point, it is very unlikely that we are going to see managed care companies requiring these types of tests because they are not readily available or reliable at this point. But within the next 5 to 10 years, we certainly would expect that diagnostic testing is required prior to whenever a prior authorization would be approved for payment for that medication. When a patient is looking for financial assistance to help them pay for their medications, whether it's for psoriatic arthritis, psoriasis, or other autoimmune diseases, we frequently are asked in our specialty pharmacies, is there any materials or websites that we could direct people to in order to help them find financial assistance? When patients ask us at specialty pharmacies, we frequently are able to them due to having patient assistance departments that actively work for financial aid. Whether that's financial assistance programs that are available out there through foundations or through different organizations such as the Arthritis Association, there are monies available for patients, and we as specialty pharmacies are readily willing and able to help patients find the appropriate financial assistance for their unique needs. We would refer them to the Arthritis Association to look specifically for the medication they're on to see if there are any financial assistance programs that they could access. Or they may call the specialty pharmacy they are using and request assistance from the patient assistance department. The pathways that we discussed that specialty pharmacies should be using for clinical guidance are currently being used by specialty pharmacies. Many of the accreditation bodies have requirements for specialty pharmacies to have clinical pathways in place where questions are asked of patients, information is collected, and then it is trended in order to determine outcomes for the patient. The pathways should be looked at from the standpoint of using evidence-based medicine, references available, and any peer-related journal information that has been published in order to create the pathway and to make the most effective one for the patient for the specific medication that they are receiving. Specialty pharmacists have the unique ability to get accredited in certain disease states based upon what is available right now. So whenever we train our specialty pharmacists, many companies will have their internal training processes on the disease states for the patients that they serve. In addition to that, the pharmacists may be able to retain through nationally accredited bodies a specific certification as a specialty pharmacist or other certifications in disease states in which they wish to work, such as oncology, multiple sclerosis, and other areas.